When it comes to multiple sclerosis care, something of a quiet revolution is underway. We're moving way beyond just thinking about medication and stepping into this really fascinating new era. It's all about collaborative teams and some seriously cutting-edge technology. So let's dive right in and see how rehabilitation for MS is being completely transformed. We wanted to start with this quote because, well, it immediately sets the stakes, right? We're talking about a condition that has a profound impact on people, often right in the prime of their lives. So this isn't some minor issue. It's a huge challenge that really demands our best, most innovative solutions. So what is it that makes treating MS so uniquely difficult? Let's get to the heart of the problem. MS is what's known as a pleiotropic disease. Now, that's a pretty technical term, but all it really means is that it can show up in a ton of different ways. It's not just one thing. It can affect how a person moves, how they think, how they feel. It creates this incredibly complex web of symptoms that a single approach just can't possibly fix. And here's where we see a real gap in the treatment. We've got these incredible disease-modifying therapies, drugs that are absolutely crucial for slowing down MS in its tracks. But here's the catch. For the damage that's already been done, for the function that's already been lost, medications often aren't the answer. And that leads us to the big question, doesn't it? If slowing the disease is just one piece of the puzzle, how do we actually help people get function back and improve their quality of life? Where do we even begin?
Well, the first part of the answer is a massive shift in how we even think about care. It's about going from a solo act to a full-on team. Think about it. The old way, where one single doctor was supposed to be an expert on every single facet of this unbelievably complex disease, is now considered, and I'm quoting here, wholly inadequate. The new model, it's much more like a Formula One pit crew. You've got a whole team of specialists, each a master of their own domain, all working together for one single goal. And here's a look at who's on that pit crew. You've got the MS nurse, who's often the central point person, the physical therapist, who's tackling the movement issues, the psychologist, helping with the cognitive and emotional side of things, and then specialists like urologists and speech therapists who zero in on very specific but very common challenges. See? Each expert is there to address one of those many faces of MS we just talked about. But a great team needs great tools. And that brings us to the second part of this whole revolution, the tech. We are seeing an absolute explosion of new technologies in rehabilitation. I mean, stuff that sounds like it's straight out of science fiction is now becoming a clinical reality. We're talking about non-invasive brain stimulation, immersive virtual reality, and even telerehabilitation that brings care right into a person's home. All of these are just incredible. But to really get a handle on the kind of impact we're talking about, let's zoom in on just one: robot-assisted gait training, or RAGT. And yeah, it's pretty much exactly what it sounds like, using robotic devices to help people retrain their ability to walk.
Of course, this is the million-dollar question, isn't it? It's one thing to have a cool piece of tech, but does it actually move the needle for patients? Let's see what the evidence has to say. So a huge new meta-analysis started by looking at nearly 7,000 different scientific studies. This was no small peak. They cast an incredibly wide net to find every single piece of data they could on robotic rehab for MS. So how did they get from almost 7,000 studies down to the few that really tell the story? This chart shows you the whole process. They got rid of duplicates, screened out papers that weren't relevant, and then checked the rest for quality, over and over, until they were left with just 12 high-quality studies. This is how you find a clear signal in a whole lot of scientific noise. And this is what all that combined data looks like. Now, I know these charts can look a little intimidating, but the message they have is actually super simple. Each of those horizontal lines is a single study, and that diamond at the bottom, that's the combined result of all of them. The only thing that really matters is where that diamond lands. So what does it all boil down to? On two really important tests of mobility, the robotic training had a significant positive effect. For the 6-minute walk test, patients could literally walk farther. That means better endurance. And for the timed up and go test, they got faster at standing up, walking, and sitting down again, which points directly to better balance and mobility. This isn't just about statistics. This is a real, tangible improvement in someone's ability to move through their world.
Okay, so what happens when you put all of this together? When you combine that expert human team with these powerful new tools?
This right here is the main takeaway. The future of MS Care isn't a choice between a great team and great tech. It's the synergy, that powerful combination of the two working together. It's a physiotherapist using a robotic gait trainer or a psychologist using a VR program. That's where the real magic happens. And that leaves us with one last thing to think about. As we bring more robots, more AI, and more tech into the clinic, how do we make sure that the heart of it all, the human connection, the empathy, the advocacy of that amazing team, doesn't just survive but actually gets stronger? That might just be the next great challenge.